doing well on yourself?
Not too bad. So my name is Laura, and today we're going to do an assessment of your skin, head, face, scalp, ears, and eyes, and nose.
Okay.
So, can you look at your hands? So first we're going to inspect the skin on the upper extremities. Color is pink, the temperature is warm. Skin turgor is less than 2 seconds. Capillary refill is less than 2 seconds. The nails are hard. They adhere well to the bed. Can you do like this? We're going to check the contour of all your nails. Okay, so there's no spooning or clubbing noted of the nails. Next we're going to do the lower extremities. So you can hold out your feet. So the hair pattern on the legs and feet is male distribution. There's no swelling or edema noted. Capillary refill is less than 2 seconds. The nails adhere well to the bed and are firm. The skin color is pink. The temperature is warm. And there's no varicosities on the lower extremities. So next we are going to do your head, neck, and scalp, or your head, face, and scalp. So for your head, the size is round. The shape, it is symmetric on both sides. The condition of the scalp, there's no dandruff noted. Scalp is movable. Any pain in your scalp?
No, ma'am.
Okay. So next we are going to inspect your hair. So your hair is short, brown, clean. It is normal in male pattern distribution. We are going to palpate your sinuses. So tell me if there's any pain.
No pain.
Okay.
No pain.
Okay. So there's no pain associated with the sinuses. So next we're going to do your temporomandibular joint. I'm just going to put my hands here and open and close your mouth a few times. Okay. So the TMJ, there's no crepitus noted. It moves symmetrically bilaterally, and there's no clicks. So next we're going to test cranial nerve 5, which is the trigeminal nerve. We're going to do the motor and sensory. So for the motor, we are going to test your jaw strength. So if you can clench your jaws together and move them side to side. Okay. So the motor part of the trigeminal nerve is intact. Sensation, I'm going to take some gauze and close your eyes, and I'm going to touch you 3 different places. Tell me if you can feel it.
Feel it. Feel it. Feel it.
Okay, so feeling the sensory is intact for the ophthalmic, maxillary, and mandibular part of the trigeminal nerve. So next we are going to test cranial nerve 7, which is the facial nerve. So we're going to make some faces. Smile, frown, raise your eyebrows, close your eyes. Don't let me pry your eyes open. Show your teeth, puff out your cheeks, and purse your lips. Good. So cranial nerve 7, the cranial nerve or the facial nerve is intact. So next we are going to do cranial nerve 2, which is the optic nerve. So first we are going to discuss the Snellen chart that is used for distance vision. So you would stand 20 feet away from the chart and read down to the lowest line you could read, and that will tell you your distance vision, and you would do that with or without correction. So for near vision, we would do the Rosenbaum test, and that would be 14 inches away. You would read down to the lowest line you could read with and without correction. So next we are going to do the peripheral field of vision test. So cover up the same eye that I cover up on this side. So then tell me if you can see my fingers.
I can see it. Cannot see it.
Okay, so then tell me when you can see them again.
Yes, ma'am. I can see it. I cannot see it. I can see it. I cannot see it. I can see it. Cannot see it. I can see it.
Okay. Keep your same eye covered.
I cannot see it. I can see it. I cannot see it. I can see it. Not see it. I can see it. Not see it. I can see it.
Okay, so then we're going to do it with the other eye.
Cannot see it. I can see it. 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 Cannot see it. I can see it.
Okay, so the peripheral fields of vision are intact. So if they weren't, we would do something called the cover-uncover test, where I would have you stare at something directly behind me, and I would have you cover one eye, and I would hold my finger here and have you remove the hand from your eye and see if your pupils would converge. So next, we are going to do extraocular muscle function, and we're going to test cranial nerve 3, the oculomotor nerve, cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens. So we're going to do this by the 6 cardinal fields of gaze. So I just want you to follow my finger. So there's 2 to 3 beats noted with some lateral movement, and that's normal for that. Next, we are going to do the corneal light reflex. So I'm going to shine this light right in the middle of your eyes. Don't look at it, look at something behind me. So I can see the twinkle in both of your eyes symmetrically. But if I couldn't, that's when we would do the cover-uncover test. So next we are going to inspect and palpate your eyes. So your eyebrows and your eyelashes are short and brown. There's no dandruff or lesions noted. The palpebral fissures are symmetrical bilaterally. There's no lid lag. The eyelids are symmetrical on both sides. The external eye, the cornea, I'm going to look at with the light. Side, look straight ahead. So the cornea is clear. There is no cataracts or cloudiness noted. The anterior chamber of the eye is also clear and round. The sclera is white. The position of the globe, it is circular and symmetrical on both sides of the head. The iris is brown. The pupils are small, round, black. Next, we are going to check your pupils for reaction to light. So just look straight ahead. I'm not going over your chest. So pupils are equal, round, and reactive to light and accommodation. And follow my finger in. And they converge bilaterally. Next, we are going to palpate above your eye again, the lacrimal sac. Any tenderness?
No, ma'am.
Okay. So next, we are going to examine cranial nerve 2, the optic nerve, and I'm going to actually look in your eyes. So just look straight ahead at someone behind me. In your eyes, the optic disc is round. It is 1.5 millimeters in diameter. It is located nasally. It is an orangish yellow in color, and the physiological cup is located in the center, and that's where the vessels enter and exit the eye. Also, when I looked in your eyes, I did see the red reflex, and the lenses were clear. So retinal vessels were also noted. There was no presence of hemorrhages or exudates. The arterioles outnumber the venules by a 3 to 5 ratio, and if they cross at any point, there should be no nicks or bulges. It should be clean lines. And the retinal background is an orangish pink in color. There's no hemorrhages or exudates noted. So next, The macula is creamy and gray in color, and the fovea centralis is darker and it's in the center. So we're going to take a quick break and scan the room. Okay, gotta get you back in focus. So next we're going to look at your ears. So the auricles are symmetrical on both sides. They are midline to the head. They are pink in color, and they're symmetrical. Any pain?
No, ma'am.
Okay. So I'm going to look in your ears with the otoscope. Tell me if it hurts.
No, it doesn't hurt.
Okay.
No, it doesn't hurt.
Okay. So, in your ears, the tympanic membrane was noted, and it was gray in color. The cone of light on the right ear was at 5 o'clock, and the cone of light on the left ear was at 7 o'clock. There was a small amount of cerumen noted. The umbo is in the center, the malleolus. It looks like the handle. The top is the pars flaccida, and the bottom is the pars tensa. So next we're going to do the whisper test. I'm going to stand behind you and whisper something, and you cover the ear of the side that I stand on, and then tell me what I said.
1, 2, 3. 4, 5, 6.
Okay, so your hearing is intact bilaterally. So next we're going to do the Weber test, and I'm going to take this, and I'm going to put it on the top of your head, and tell me when it stops vibrating, or
Yes,
when you
ma'am.
hear it stop vibrating.
Stopped.
Okay, so next is the Rin or Renee test. So I'm going to move it 2 places beside of you, and tell me when you can hear it, and when you can't hear it both times.
Yes, ma'am. Stopped. Stopped.
Okay. So air conduction is greater than bone conduction by a 2-to-1 ratio. No, it's not. So next we are going to do your olfactory nerve, which is cranial nerve 1. So the nose is midline to the head. It is proportionate to the shape of the body, or to the size of the head. And next we're going to look up your nose. So tilt your head back. So the terminates were noted. They were pink and moist. Any pain in your nose?
No, ma'am.
Good. So the septum was noted, and the mucosa was pink and moist. So next we're going to have you smell 2 things after you determine the patency of the nostril. So close one nostril and sniff. The same thing the other side. So both nostrils are patent. So now we are going to test your smell. Cover one nostril.
It smells like cinnamon.
Good.
It smells like vinegar.
Awesome. So cranial nerve 1, the olfactory. Cranial nerve 1, the olfactory nerve is intact. So next we are going to look at your mouth and your pharynx. So your mouth, your lips, they are pink, The vermilion border is well defined. They are moist. Can you open your mouth? Stick out your tongue. Say ah. Okay, so your mucosa inside is pink and moist. The palate rises and falls symmetrically. The uvula is pink, moist, midline. Can you lift up your tongue? So the sublingual frenulum is noted and the Wharton ducts are noted. The frenulum is midline underneath of the tongue. So I'm going to feel your cheeks. Open your mouth. So the Stenson ducts are noted in the cheeks. So next we are going to inspect the tongue, the uvula. This test with the uvula opening your mouth and saying ah, that test cranial nerve 11, which is the glossopharyngeal nerve, and cranial nerve 10, which is the vagus nerve. The patient also innervates swallowing, speaking, and gag reflex. So next, we are going to inspect cranial nerve 12, the hypoglossal, and that's tongue movement. So can you stick your tongue out again and then move it side to side? So cranial nerve 12, the hypoglossal nerve, is intact. So next, we're going to inspect your neck. So your neck is midline to your body. It is symmetrical on both sides. The trachea is midline. So I'm going to palpate the cervical spinal process and tell me if there's any pain.
No pain.
Okay, and the paravertebral muscles.
No pain.
Good. So next we're going to do range of motion with your neck. So forward, back, right, left, and side to side. And then around. So the neck has full range of motion. So next we're going to check cranial nerve 11, which is the spinal accessory. So I'm going to put some resistance as you do these exercises. So shrug your shoulders. Turn your head towards my hand. Other way. And so your cranial nerve 11, the spinal accessory nerve, is intact. So next we're going to look at the trachea. I'm going to have you swallow. So the trachea rises and falls when the patient swallows. It is midline and symmetrical to the neck. So next we're going to feel your lymph nodes. So preauricular, postauricular, and tell me if anything hurts. Submental, submandibular, mandibular, submandibular, sublingual, the anterior chain, posterior chain, the deep chain, and the occipital nodes. Any of that hurt?
No, ma'am.
Okay, so none of them were palpated, which is normal. So next we are going to feel your carotid arteries one at a time. So the carotid artery is strong and bounding. We're going to listen to it. So there are no bruises heard with the carotid artery. So next we are going to feel and listen to the thyroid gland. So I'm going to have to get behind you to do that. So when you look down and turn your head to the left and swallow. And then turn your head to the right, swallow. Okay. So the thyroid gland was palpated, and there was no nodules or swelling noted. So next we're going to listen to it. Turbulence and hums were heard. So now for the rest of the assessment, we're going to have to go into the other room so we can relocate. 237.